Hello, I'm Courtney Maneri Philippi, and today I'm going to talk to you about the book that I read called Patience Comes Second by Paul Spiegelman and Britt Barrett. And I chose this book because it is contradictory to what you would typically believe the order of importance is in a healthcare setting, and that really intrigued me, so I really wanted to read more. So let's first meet the authors. The first author is Britt Barrett, and he is the former CEO of Medical City Dallas Hospital, but he is now the current president of Texas Health Presbyterian Hospital. And Texas Health Presbyterian Hospital is actually a 900-bed hospital, so it is a fairly large hospital to run. And our second author is Paul Spiegelman, and he is the CEO and co-founder of Beryl Health Companies in Dallas, Texas. And Beryl Health is a company that specializes in patient service experiences or patient experience services. And so Beryl Health as an institute does a lot of research and publishes a lot of that research that validates the connections between patient experience and better clinical and financial outcomes. And so both of these companies are very well known for the fact that they had low morale, high attrition, and low margins. But under the leadership of Barrett and Spiegelman, they were able to achieve industry-leading metrics, including employee loyalty and retention. And so they were both able to achieve financial success. And then both of these organizations have now been recognized locally, regionally, and nationally as best places to work more than once. So Barrett and Spiegelman were able to achieve such great results in such low performing organizations. And so how do they do that? In this book, they dive into a few different themes to kind of help us as readers learn these things and implement them into our own organizations. And one of the first themes that they really dive into is this idea of changing the way our leaders lead. And so the current model right now is this scientific model, which Suchman et al. Describes as very much machine-like. And so the leader is the leader, and the employees do what the leader says because that's what they say. And the leader makes all the decisions, and then they're responsible when things go good or bad. And so they're saying that this is not an effective way for an organization to operate if you want employees to stay loyal and to see financial gains. And so their proposed organization management style would be more of a relationship-centered administration. And Suchman et al. Describes that as more of a fluid relationship where the leader is right alongside of their staff and they're asking them how they can help. They're having the conversations, and the employees are part of making decisions and making changes throughout, their department. And so Burchos and Purdy state that being a leader requires you to be open, honest, and transparent with your staff. And so allowing them to help you make decisions is very important because then they feel like they're being heard and they feel like they get to be part of the decisions that are happening. And so Barrett and Spiegelman are saying that patients come second. So who actually comes first? And Brett and Spiegelman are saying that the employees come first. And they explained that the importance of employee engagement and how having engaged employees can lead to better patient experiences, which can lead to more positive financial results as well. And so another article that I read by Lytle et al. Did find that there is kind of a difference between employee engagement and employee satisfaction. But they found that in their organization, when they had employee engagement throughout, they also found an overall engaged workforce, which led to more positive experiences for their patients, which led to, you guessed it, positive financial results. And so Britt and Spiegelman also explained that getting your staff engaged in project improvement projects as well is also very important because teaching them how to help process map and do root cause analysis and fishbones helps them, again, feel really heard, and they get to feel like they're part of the decision-making process. And let's be honest, our frontline staff know the jobs better than any of us, and so they are vital to making these decisions for our department as well. And so why put so much emphasis on our employees? Why do they come first? While all of the things that I just mentioned lead to a happier and more engaged employee, why is that important? Well, our employees are the ones that are creating the overall patient experience. and they're the face of the organization, and they're also helping to shape that reputation. And so if our employees are not engaged and they're stressed because they're of low staffing, and the patient they go into the patient room and they interact with them, and now they're short and they're not as friendly as they normally are, the patient will feel that, and so their experience will be tainted by that. And no matter who comes in their room next or what they experience, they will always remember that one negative experience that they had. So every organization has this group of people: the whiners, the losers, and the jerks. And so what did these types of employees cost our organizations? Barrett and Spiegelman painted a picture that the overall lifetime value of a single patient is around $250,000. So if you have, say, like the nurse that's pictured, that was a jerk and didn't respect the patient, not only did that nurse get fined, but that patient will now tell their family and friends not to go to that organization. And while if a patient's lifetime value is $250,000 and this patient has 4 family members and also told 6 friends, that's about $2,500,000 in loss because of one nurse. And so these types of people, no matter what their status is in the organization, need to be removed. They could be your highest earning surgeon, but if their attitude is not good, they could still end up costing you. So even your highest earning surgeon could end up costing you with a bad attitude, because you really could hire another surgeon who is just as good with a better attitude, that works better with their colleagues, and they could actually potentially end up making you even more money than your previous high earner with the bad attitude. And so an article by Hogg et al., they reviewed patient letters, and they had good and bad in those letters, and so you know that they weren't complaining just to complain. But a lot of those letters stated poor staff behaviors and attitudes, and these letters, talked a lot about how staff were lacking emotional intelligence, and they didn't seem to understand how to interact with families and patients that were going through a tough time. And so those are the employees that are costing your organization, and they should be removed, not only for the sake of the organization, but of course, for the sake of our patients. So we've discussed that employees come first and patients come second. So where do the financials actually fall into this equation? So Barrett and Spiegelman, are saying that the financials actually come third. So let's be honest, most leaders seem to have this backwards. And I know that in my own organization, I seem to find that as well, that leaders are actually focusing on the financials to make it better because they think that will make the organization better. But focusing on the numbers first is actually disengaging their employees, because now their employees feel like they're just working to make the organization money, and so they don't really feel appreciated at all. And so when you have disengaged staff, their behaviors kind of rub off on the patients, leaving the patient with a bad taste in their mouth for the organization, which now will cost you money in the long run. However, if you have your employees as your main focus, and you're creating the right kind of culture, that's what your patients will feel, and that financial gain will follow that. And so how do you change that culture that we're all experiencing? Barrett and Spiegelman are saying that by sending out surveys to your employees first, so that you can really see what they believe executive leadership's priorities are, and ask them what inspires them, so you have a place to start to know how to, get them engaged, and you can create a plan based off of that, and you should be able to start seeing results throughout the organization. Another theme that Barrett and Spiegelman focused on was this idea of committing to a lifetime of learning. And so Mello et al. Explains that in healthcare, things are always changing and evolving, and if you're not willing to continue to learn, you're going to fall behind. And it's important to really learn about the people around you as well, because healthcare has become so diverse that you really want to learn about the people around you and their cultures so that you know how to interact with them and you can communicate better. And that doesn't necessarily mean that you need classroom education. It could be as simple as reading articles, or trying something new, or even just having the conversation with them. And so Barrett and Spiegelman explained that even Steve Jobs, when he was in college, took a calligraphy class. And you would never think that Steve Jobs taking that calligraphy class would have such an impact on his career in electronics. However, Jobs attributes the design of Apple to that calligraphy class in college. So you never actually know when the things that you learn are going to impact your life in such a huge way. So it's important to continue being a creative thinker and also being innovative. Another theme in this book that Barrett and Spiegelman challenge the readers to do is to find a mentor. And sometimes it's not easy to go up to someone that's, a higher level than you and ask them to be your mentor and take time out of their already busy schedule to mentor you. But it can be very, very beneficial. And likewise, if someone were to come up to you and say, hey, do you mind being my mentor? To make sure that you make the time and be a good mentor to them since they took the time to ask you. And in an article by Gandhi and Johnson, they implemented a Mentor the Mentor training program. And it was where more successful mentors trained newer mentors in a lot of different skills and things that they've learned so that they can be better mentors. And that they found that this was actually very successful, that the mentors that were being mentored felt like it was really successful, as well as the people that ended up being mentored said that it was very successful and that their mentor was really great. So the last major theme of this book is this idea of the higher power that drives us to do the work that we do, and also what kind of legacy that we really want to leave behind. And so Barrett and Spiegelman explain just how important in this demanding field why it is to know what your why is and why you do what you do. Not only that, but it's important to share with other people what your why is so that you can inspire them. And it's also important to find out what other people's why is or are so that you can make sure that you understand them better and maybe why they do some of the things that they do as well. In a TED Talk by Simon Sinek, he says to the audience, we all have that one teacher that was instrumental in our education, and I want you all to say their name out loud together right now. And after they all say that name, he says, years and years later, you remember that person's name and what they've done for you. And so wouldn't it be amazing in 20 years if your name is the one that someone says as being instrumental in some way in their life? And so likewise, Barrett and Spiegelman explain that healthcare is a high burnout type of work, and it's truly important to know what kind of legacy you want to leave behind. So on your deathbed, what do you want to be able to say you achieved? What are the things that you don't want to say that you regret? And that all kind of ties back into employee engagement as well, because it's important for you as a leader to understand what kind of legacy your employees want to leave so that you can kind of help support them in the best way to achieve that. And I've thoroughly enjoyed reading this book, and all throughout reading it, I've been sharing these ideas and these theories with my frontline staff, with other leaders, and actually my own leaders. And I find that my staff and my colleagues really seem to understand it, but my own leadership, which is a director and a VP, tend to not understand it as well. They're still very much focused on the financial part. And so I see a challenge ahead of me to try to help shape or reshape their thinking and to see the benefit of taking care of your employees first and your patients second, and then worrying about the financials third. And I challenge you all to have these conversations with your staff and your colleagues and your leadership, and to kind of see what they think. And maybe you have to reshape their thinking as well, because I do really wish more people understood this concept and thought this way. But even if we can change one person's thinking to match this, then it could have a ripple effect and it could really do amazing things and touch a lot of lives. Thank you for listening.